Hey folks, answering a question today. Can going vegan, can adopting a whole foods plant-based diet reduce your risk of dying from coronavirus? And I am in no way qualified to really answer this question, but I've been looking into some of the data that we have available to us. And what are your thoughts on this stuff? I'd be interested to know, um, and I'm open to discussion on what I'm suggesting in this video. But here we have Worldometer, and this is worldometers.info, and the source of the information that they post on this site comes from the CCDC, which is a body in China and that has dealt with the fallout from the original breakout in Wuhan, and also the WHO, the World Health Organization. This is the bit that I'm most interested in just down here, and this is the comorbidities, or your pre-existing medical conditions. And these are the things we're hearing a lot about in the news, that people are dying with coronavirus but also with underlying conditions. How often have you heard that from media outlets? So and so died, such and such died from coronavirus or with coronavirus with underlying medical conditions. And so this graph here shows us, it's not a graph, it's a table, it shows us the likelihood of dying if you have one of these underlying conditions. So if you have cardiovascular disease, and that includes coronary heart disease and all of that horrible stuff, you are 10.5% likely to die if you contract coronavirus. And if you have no pre-existing condition at all, you are less than 1% at risk of dying from coronavirus. And then you've got all these other ones in between: diabetes, chronic respiratory disease, hypertension, and cancer. Pretty interesting, by the way, that if you have chronic respiratory disease, despite coronavirus killing you through a sort of pneumonia type effect in the body, really interesting that cardiovascular disease and diabetes affect your likelihood of dying more than if you've got a pre-existing respiratory disease. That's pretty interesting to me. I would have thought if you've got some sort of respiratory disease, that would put you at the highest risk. But according to this data from the CCDC and the World Health Organization, not so. Cardiovascular disease, diabetes are the highest number of deaths if you have one of these pre-existing conditions. But to compare, let's just compare heart disease, cardiovascular disease, with non-pre-existing conditions. If you don't have a condition, you are less than 1% chance of dying. And if you have cardiovascular disease, you are 10% or more than 10% chance of dying. So that means you are 10 times more likely to die from coronavirus if you have cardiovascular disease. So you've only got a 1% chance if you don't have heart disease. But if you do have heart disease, you've got a 10% chance. You're 10 times more likely to die if you've got heart disease. But you're only 1% likely to die if you only have coronavirus. So the way I look at this is, the real risk here is the heart disease. The real risk isn't the coronavirus. The real risk is the heart disease. So if you want to stay alive, if you want to increase your chances of staying alive, not having heart disease seems to be the way to do that, rather than not having coronavirus. Because if you've got coronavirus, you've only got 1% chance of dying. But if you've got cardiovascular disease and you contract coronavirus, you've got a 10% chance of dying. So the risk here is in having cardiovascular disease, or indeed diabetes, hypertension, or cancer. And this is the crux of this video. This is information that I've been sharing for the last few years, but there is undeniable evidence now, scientific, hard, undeniable evidence, that whole foods, plant-based diets can prevent, and in many cases reverse, these things that we see in this table here. So all four of these, cardiovascular disease, diabetes, hypertension, and cancer, can all be addressed using whole foods, plant-based diets. So one of the sources that I want to share with you is WebMD, Simple question, can you reverse heart disease? And there's a bit of an introduction here, and then further down it says, yes, you can. And it mentions Dean Ornish, who is one of my heroes, really, one of my main influences for all the work that I've done with exmahealing.org in terms of turning off the underlying conditions that cause autoimmune diseases and all that sort of stuff. But here he talks about heart disease, which is relevant to the coronavirus to the tune of 10%. And he's written a book called Dr. Dean Ornish's Program for Reversing Heart Disease. And it centers basically around a whole foods, plant-based diet. And I encourage you to look up the work of Dean Ornish. And there are other doctors as well. He works alongside somebody else called Caldwell Esselstyn. And also Neil Bernard is involved via the PCRM, which is the Physicians Committee for Responsible Medicine. And together as a team, they are putting out this information showing that whole foods plant-based diets can, in some cases, reverse these chronic degenerative diseases that are affecting the Western world. So this here is Dr. Neil Bernard, and I think he's the president, or he's in charge in some way of the PCRM, the Physicians Committee for Responsible Medicine. And here he stands with somebody holding his book, Dr. Bernard's program for reversing diabetes. And there's a lot of information on him too on the interweb. And I encourage you to look up information about Dr. Neil Bernard and his program for reversing diabetes. Remember, we're not talking about prevention here. We're talking about actually reversing these conditions using whole foods, plant-based diets. And there's a lot of hard evidence now to prove that there are hundreds, thousands, maybe even millions of people around the world using this type of information to get their diseases gone, reversed. There's a couple of examples here on this page where the guy in the photo, Stan, has got his hemoglobin A1C, which is one of the key markers for diabetes, down from a start of 6.7 down to 5.6, which indicates he's below the level for pre-diabetes. And I have personally met people in London when I used to volunteer at food classes and that sort of thing. I've met these people who have done this, who have got their medications down, they're no longer using metformin, they've actually reversed their diabetes. And I also have come across people that I've actually met, spoken with, who have gotten rid of their heart disease using the same sort of thing. There's an amazing video on YouTube called Uprooting the Leading Causes of Death by Dr. Michael Greger, and he gets into the leading causes of death in America and also in the UK. He's done a UK version of his talk. And he demonstrates how with a whole foods plant-based diet, you can address the condition. And so coming back to our graph here, if we're able to adopt a whole foods plant-based diet and address these underlying causes, in my opinion, this is the most important thing that we should be doing right now. Because let's say coronavirus doesn't get us, there might be more viruses coming down the line. And we want to be as resistant to those viruses as possible. Why would we sit there with a tenfold higher chance of dying from coronavirus than if we didn't have the condition? And there is something we can do about it. And there's hard evidence to show that we have a chance of reversing our condition. It defies me that there are not more people out there who I come across who are trying to do this. I come across people with cancer, heart disease, diabetes all the time. There are multiple people in my own family with these diseases. And I'm just blown away that even on receipt of the knowledge that this can be done, they're not trying their best to put these things into practice and to do it, to get the information, to watch the videos, to read the books. There's so much help, and there's people on the internet who want to help you to do this without charging you for any sort of coaching services, because they believe so strongly that there shouldn't be people on suffering like this with these diseases and at much higher risk when these superviruses come along. So please don't just take my word for it. do your own research on it. There's two amazing documentaries that I can recommend. One of them is called What the Health, and another one is called Forks Over Knives. And these get into the whole foods plant-based diet and serve to educate us into how to go about starting this, or just get in touch with me directly and I will help you to get a program together of how you can set yourself up with a whole foods plant-based diet and start to address the condition that you have. This is not rocket science. This is really easy, simple stuff. And it's not dangerous because we're not talking about medications or tests or going into laboratories or hospitals. We're talking about food. We're talking about stuff that you make from home yourself, supermarket trips, just really simple stuff. And I know a lot about this because it's the same process that I use to heal my own eczema, to heal my own skin. And I coach people to do that, primarily with skin, like acne, eczema, psoriasis, dermatitis, and all that sort of stuff. But to be honest with you, largely the same program from reading up on, read these books, even if you don't have these conditions, because this is just vital information for us as humans to thrive, to have the greatest participation in our daily realities, to live the healthiest possible lives that we can. This is essential information. So go watch those documentaries if you possibly can. Another great one to watch, more recently released, is called Game Changers, and that's a really important one if you're into fitness or athletics of any kind. That's my video for today. Non-skin related, but very relevant to what's going on. I just really felt like I needed to make this video and just get this out there. Let me know. Am I onto something here? Am I way off track, way off course? Let me know in the comments down below. We'll see you in the next video.